the patient, unfortunately, turns into a different expression and condition, which is called the overvolumized syndrome. As we age, aging happens in three general aspects and three general lines. First, we lose volume. We lose volume in the skin, we lose volume in our fat pads that we have, we lose volume in the muscle, we lose volume in the ligaments, everything which is underneath the skin, and we lose volume in the bone. Number two, we have, of course, what is called the redundancy and the sagness of the structures related to the skeleton. So there are 5 zones. We call them the zones of adherence. Fixation point at this area here, and then we have a fixation point at this area here that goes along this line here, and then we have one here, and then we have one here, and then we have one almost here. Most of them are actually nailed to the skeleton in those 5 regions. I want to talk about a bias that is called a bias of selection. If a doctor or the treatment provider has one option on the table instead of 3, so he knows that this option would work with all the possibilities, and he will create a bias in his mental way of thinking that he has only this tool and weapon to treat all the problems. Assume that a patient would come to me and I have one weapon in my hand, which is only adding volume, because I have that tool, that only single tool that I can use in order to overcome the problems of aging. I don't know anything about threads. I don't know anything about facelift. I don't have any capability to do any surgical procedures regarding the sagness and releasing those retaining ligaments that I mentioned. The only thing that I have in my hand is to volumize and restore the volume. We have to restore the volume. Either we're going to restore it with fillers, fat, it doesn't matter, or with implants, but I'm talking about a bias of selection. So, how can we treat the overvolumized syndromes? Well, eventually we have to remember the 3 concepts, revert everything back. So we have to restore the sagness. We have to release the retaining ligaments. And then we have to devolumize the patient and then revolumize it in the proper way. But since you're going to release those retaining ligaments properly and you're redraping everything as it was 20 years ago, that will create the foundation of youth. And then you can add the volume upon that foundation in order to achieve a full naturality. I hope that this video was very informative and instructive for you. If you have any questions, please do not hesitate to ask us. Don't forget to subscribe in our channel and tick our button as like. Thank you very much.